I wanted to start by asking you a little bit about CALM. Can you describe what it is and how it works?
CALM stands for Child Anxiety Learning Modules. It's a very brief intervention that we developed for school nurses to use with the students who frequent their office with anxiety. And the current iteration of CALM involves 5 meetings, generally about 20 to 30 minutes, that the school nurse spends with the student, teaching them coping skills so that they can practice them and ultimately reduce their anxiety so that they can stay in their classrooms, learn better, have an easier time at school and hopefully at home as well.
Are they, for the most part, trained to recognize anxiety? Is that part of what a nurse does on a normal basis now?
Not typically. So unfortunately, and this was why we developed CALM and were funded to do this work, was there really was a gap in the skill set that nurses had, really just because they didn't get it in their training, to identify, assess, and really assist students with anxiety. So that's what we provide, is a brief training for nurses. What are the signs to look for, and what can they do in a brief way, given their busy schedules, to help these students.
What are some of the signs, and does it differ by age group?
So the signs are pretty similar for children and adults, actually. And we know that there are 3 key signs. And in fact, we encourage nurses not only to look for the signs, but to teach their students how to be detectives and find those signs in themselves. So once they identify signs of anxiety, they can implement some of the coping skills that they've learned from the nurse. So the 3 core features that we look for and that we teach nurses to look for are, first and probably most relevant for school nurses, are physical symptoms, or what we call somatic complaints. These are headaches, stomach aches, nausea, dizziness, all of the physical signs that occur because of anxiety. And oftentimes these are the symptoms that lead students to go to the school nurse. I don't feel good, I want to go home. And nurses often can't identify a medical reason. So that's a core sign of anxiety in the students that the nurses will see. The second are the way the child thinks about things. So we all, in a way, talk to ourselves all the time. But if you listen to the thoughts or the themes of the thoughts that students with anxiety have, they're all about danger and harm. So, will I get sick? Will my parents die? What if I fail the test? What if other students laugh at me or I make a mistake? All of those kinds of ways of thinking increase anxiety or contribute to maintaining anxiety. And the third sign is in their behavior. And the most common behavior, and really the most problematic, is that students with anxiety, and grown-ups too, will avoid what they're afraid of. So instead of, imagine if you're afraid to fly, you're going to try and avoid going on an airplane. So it's avoidance that really maintains anxiety. And kids in the classroom will try and leave the classroom. They'll avoid staying in the classroom and go to school nurse. They might avoid just raising their hand. They might avoid sitting or talking to other students. They might avoid eating in the lunchroom, playing with other kids at recess. Depending on the nature of their anxiety, they'll avoid whatever anxiety-provoking situation is a trigger for them at school. They'll avoid.
Could you run down what you're teaching the nurses to do?
Sure. So first we teach the nurses some basic psychoeducation, like what is anxiety? What are the signs to look for that I just explained? And then what we teach them is that the skills that are evidence-based, meaning that they have been tested in other clinical trials and been shown to reduce anxiety, both again in children and adults, is what we're going to teach the nurses. It's what we have been teaching the nurses to teach their students. And so we start with really educating this. The nurse will educate the students on what is anxiety, what are the signs, those 3 signs. And then each of those three signs have a parallel coping strategy. So for example, after the nurse begins teaching the signs of anxiety, they'll then teach the student relaxation skills to calm the physiological symptoms, the racing heart, the nausea, the headaches. So there's a variety of skills, and many nurses know about these relaxation skills. People in schools are adopting mindfulness practices, deep breathing. And so that is the first skill that nurses teach the students. The second skill, and really the most important, is that nurses will walk through with children how to begin to face their fears. Because we know that if you avoid what you're afraid of, your anxiety stays around. You've probably heard, the old adage, what's the first thing to do if you fall off a horse or fall off a bicycle? You've got to get right back on. And again, the importance is if you never get back on that bicycle or that horse and you continue to avoid, you never develop the skills that you need to master that situation. To learn that anxiety is something you will overcome, right? If you write it out. And the more you face your fear, the more your anxiety shrinks or reduces. So that's a core strategy that the nurses will work with the students to do. Face their fear every day in small steps, but continuing to face their fear. And again, it will not only reduce anxiety, but it will also enhance the competence and confidence of the student. So they know they can stay in the classroom. They can ride this wave of anxiety out. And the third strategy that the nurses use is how to change, maybe first identify and then change those anxious thoughts that keep the child worried. So instead of saying, everyone's going to laugh at me, I know I'm going to fail the test, for sure I'm going to get sick and die, the nurses will carefully help the student evaluate how realistic is that thought? Is that really going to happen? And help the student generate thoughts that can lower anxiety, that are more realistic, what we call coping thoughts. So I can do this, even if I make a mistake, it's an opportunity for me to learn. My friends won't laugh at me. They haven't laughed before. We have a culture of kindness in our classroom. So they use kind of different self-talk that's more helpful to get them through those anxiety-provoking situations. And with time, they learn that they can master that situation.
How important is it, Dr. Ginsburg, to catch it early? How important is it to have nurses trained to identify and intervene?
It's so important that nurses and other school staff intervene earlier. So we've been working with school clinicians to train them in cognitive behavioral therapy, which is the core strategies that I've been training nurses in. And now we have a project also funded by the Department of Education to work with teachers, because teachers are with these students all day long. So everyone's on board in understanding how to identify and intervene. But the importance of intervening early cannot be overstated, because we now have longitudinal studies that follow kids from when they're young into adulthood. And what we find is that anxiety disorders are chronic conditions. So unless we intervene early, we know that these students are going to be struggling for a very long time. And we also know that students who are diagnosed with an anxiety disorder early in their life, those students are at greater risk for having adult anxiety disorders, adult depression, adult substance abuse, and a host of other problems as they're older. So early intervention is key.
Is there a parental component of this, either just informing parents or getting parents involved in some of the techniques?
We know, for instance, that anxiety disorders runs in families. So the good news is that some of the strategies that the students are learning, the parents can actually use as well for their own anxiety if they're struggling, as we all do at times in our life, particularly in this during this pandemic. But there are other strategies that parents can use. So parenting approaches that we now know can increase anxiety, versus decrease anxiety. As one example, we know that when parents allow children to avoid what they're afraid of, that tends to increase anxiety. And this is, of course, not a blaming kind of a message, I hope, for parents. But when you have a child, I know when I see my own child struggling with fear or anxiety, I want to comfort them and remove them from that anxiety-provoking situation. So it's a natural parental instinct, but it turns out that in the long run, that's not helpful for the student who struggles with anxiety. What we really want parents to do, what we're teaching nurses and teachers and counselors in the school to do, is to help children face their fear. So not help them avoid, even though it's very hard to do.
Have you and your colleagues studied the CALM intervention? What have you found?
We conducted a pilot randomized control trial. So this was part of our development grant from the Department of Education. In that study, we had 30 nurses who volunteered to be trained, and we trained them in 2 interventions, actually. One was CALM, where they learned the 3 skills that I described, so facing fears, changing thoughts, and relaxation strategies, kind of the core skills of cognitive behavioral therapy. And then we had a comparison condition where we focused only on relaxation skills. And the reason for that was we initially proposed to have no comparison group, no intervention, and just have nurses do what they usually do with a student who struggles with anxiety. And what we learned in our development phase was those students really didn't get anything because nurses weren't being trained in their programs to help students with anxiety. They did the best they could, and some did maybe do some breathing exercises to relax the students, but generally they had the students lie down. So we felt like, we want all the students to get something, and so we created this alternative brief intervention for nurses. In the pilot study, we had 54 students who struggled with anxiety, the majority of whom met diagnostic criteria for an anxiety disorder, yet had never received any treatment and hadn't been previously identified as having an anxiety disorder. This is very common, is that anxiety is an under-identified and under-treated illness. And the nurses somehow carved out 20 to 30 minutes in their day, which was a challenge, but they did it and delivered 5 to 6 meetings teaching these coping skills to students. We had evaluators who were what we call masked to what group the students received, doing evaluations both before and after the intervention, and then we did a 3-month follow-up to see whether the benefits were durable, at least in the short term, over 3 months. So that was our design, if you will, of the evaluation of CALM, at least the first iteration of CALM. And the good news was students in both groups showed significant improvement, meaning that they were avoiding less those anxiety-provoking situations. They reported fewer somatic symptoms, the stomach aches, headaches, and even the way they were thinking improved. So less anxious thoughts, more coping thoughts. And overall, they were less impaired by their anxiety, even based on child report, parent report, teacher report, and our independent evaluators.
And you said that was the first iteration. Did the program grow and develop, and then was there a follow-up to that?
We took all the feedback from the students and the parents and the nurses to modify, what worked, what was easy to teach these students, what did the students like learning the most, what did they find most helpful. And so we've actually abbreviated the intervention from 6 meetings to 5 meetings. And we're now in the midst of a large clinical trial to evaluate the efficacy of this intervention. And we're also looking whether it's cost effective because this will be a cost to train nurses, and so we want to make sure it's worth the money. And we're looking as well, of course, at academic outcomes. So how does teaching students these coping skills for anxiety improve their school attendance, their school performance, their behavior in the classroom? And this larger study, which is a 5-year study funded by the Department of Education, will also help us answer those questions.
When would that wrap up, and when would you have some data on that?
5 years from now.
Just in the context of the pandemic, Dr. Ginsburg, why are programs like CALM especially important right now?
Well, I think we've seen the impact of the pandemic on children's mental health. I think curiously it's a more nuanced story in that some students with anxiety, because they avoid what they're afraid of, and anxiety is triggered in school, staying home for a subgroup is actually easier for them. Now, of course, eventually all the students are going to be back in school, so that anxiety is going to return. But because of the worries around COVID, the impact of COVID, it's triggered more anxiety in students, and we're collecting data on that as well. We haven't analyzed it yet, but we're asking students not only how has COVID negatively impacted your life, but are there any positives? Is there any silver lining here as well? So critically important, not only because it's triggered anxiety in students, but when students re-enter, that will also be a time when students' anxiety increases as well. Do I get close to my classmates? What's the consequence of that, particularly for our worriers?
Could you see this eventually become a national program?
That's our hope. So once we have the results from this trial, this large efficacy trial, if we replicate what we found in our pilot, then the next step would in fact be to launch this nationally. And I should say that the pilot and our current efficacy trial is being conducted in New England, so Rhode Island, Massachusetts, Connecticut, as well as Maryland. So we've already kind of expanded a bit on the East Coast, but if it looks like it's really having a positive impact, we'll try and launch it nationally.
What would you want parents, teachers, and administrators to know about CALM that I might not have asked you already?
I think there are a few key takeaways that I would love parents and school personnel to know. One is that anxiety is the most common illness in children and adolescents. And unfortunately, as I mentioned earlier, it's under-identified and undertreated, and yet is associated with significant impairment. So it's really negatively impacting children's lives, but those students are not getting the help that they need. So better assessment, better identification, and more intervention is key. And that nurses, in particular, are in a key role to identify these students and to assist them, because these children are frequenting their offices.
What age, again, did you study? Is this the elementary?
Yeah, so CALM is 5 to 12. So generally it's the kindergarten kids and all the way up to sixth grade.